All right, let's dive into something that's, well, it's a fascinating paradox. What happens when the very experts we trust with our reproductive health, the doctors, actually struggle to plan for their own families?
I mean, you'd think our doctors would have it all figured out, right? Especially when it comes to their own field of expertise. But the reality, particularly for doctors who are still in training, it's just so much more complicated than you'd imagine.
So let's get specific. This dilemma, it really hits home for a particular group, obstetricians and gynecology residents. We're talking about the frontline experts in women's health.
And just so we're all on the same page, an OB-GYN resident is a medical doctor who's deep in a really rigorous 4-year training program. I mean, they are literally living and breathing reproductive medicine day in and day out on their way to becoming specialists.
So, how do we know all this? Well, it all comes from a pretty important study published in Fertility and Sterility. Researchers basically surveyed OB-GYN residents all across the U.S. They really wanted to peek behind the curtain, to see how all that intense training was actually impacting their own family planning.
And what they found, honestly, it was pretty surprising. Because you'd think these residents, of all people, would just ace any test on fertility, right? Well, the data, it tells a very different story.
Okay, so the study gave them a key fertility awareness test, basically measuring their core knowledge about reproductive timelines. And the average score for these future experts was 73%. Now look, 73% isn't a failing grade, but let's be real. That means they're missing almost a quarter of the essential information. And for a group of doctors who are literally specializing in this exact topic, well, that's a pretty big deal. It definitely points to some significant knowledge gaps.
And what's really wild is that these gaps don't seem to close with more training. The study found no real improvement in scores between a first-year resident and a fourth-year resident. On top of that, many of them tended to overestimate how successful treatments like IVF are. It's almost like they see it as a better safety net than it actually is in reality. But, this isn't just about what they know or don't know on a test. This gap has real-world consequences. It translates directly into huge, life-altering decisions. And the big one is this. A large majority of them are planning to delay having their own kids until after residency is over.
Which, of course, brings us to the pressure cooker environment of residency itself. And it begs the question, right? Why? Why are the very people who understand the biological clock better than anyone else actively pushing their own timelines right to the edge?
Well, the study asked them exactly that. What are your biggest hurdles? And their answers, they really paint a picture of the incredible pressure they're under. And it really boils down to 3 main things: the insane demands of their career, a simple, chronic lack of time, and of course, money. Serious financial constraints. Think about it, residency is this total pressure cooker. It leaves almost no room for anything else, let alone starting a family. So when you're facing all that pressure, what do? Well, for many of them, they start looking at options like egg freezing to preserve their fertility. It seems like the perfect answer, right? A way to bridge their incredibly demanding present with their hopes for a family in the future. But there's a big catch. And this chart just lays it out so clearly. The interest level in egg freezing, it's sky high. But their actual ability to get it done, it's incredibly low. And that's because they run into these huge systemic walls. Things like poor insurance coverage for it, or schedules that are so inflexible that finding the time for the procedure is basically impossible. And this quote from the study itself really just hits the nail on the head. It highlights this knowledge-practice gap and points out that these residents face systemic barriers to starting a family. So it's not about them not wanting to or making bad choices. It's the system itself, the very structure of their training that's creating the problem. Okay, so it's not all doom and gloom. The good news is, this research doesn't just point out a huge problem and leave it there. It actually offers some really clear solutions. The study lays out a path forward for medical institutions to actually close this gap.
The authors argue that a couple of key changes could make a world of difference for the very people the system is supposed to be supporting.
And the recommendations really come down to 2 key things. First, integrate real fertility education into the residency curriculum. We're talking about comprehensive planning for their own lives, not just for their future patients. And step 2, provide actual institutional support. That means things like better insurance coverage for fertility preservation and schedules that are flexible enough to make it a real possibility. And all of this leaves us with a pretty big, thought-provoking question, doesn't it? If the system creates these kinds of barriers for its own reproductive health experts, what does that actually mean for their future patients, for us? You have to wonder how their own personal struggles and delays might, down the line, shape the advice they end up giving. It's definitely something to think about.